think of. Right, so morning everybody. Some of you know me, some of you don't. I am Sally Callow. I'm Managing Director of Stripy Lightbulb CIC and founder of MeFoggyDog.org. This is a collaborative between both of my social enterprises. As you can see on the screen, this webinar is for Bedford Severe ME. Some of you will know this. Bedford Severe ME actually launched in August to mark Severe ME Day. However, after a bit of reflective practice, I thought it's not really the right day to have it. And that's why the 29th of October is now the new date. And you'll find out why a little bit later. That's part of this webinar. In this webinar, we will explore how people living with severe ME are excluded from healthcare. Thank you to Anna Carter-Windle for helping and co-presenting today. Attendees of our Cardiff Training Day will recognise Anna because she was an absolute superstar last year in Cardiff. Anna is a director of AL Training Solutions and I thoroughly recommend them for all of their training needs. I am personally recovering from a virus and I have ME myself. And I'm struggling, and Anna will be co-presenting later and I'll be taking a much needed breather halfway through the webinar. So next slide, please. What is Bedford Severe ME? It's a new annual awareness day for severe ME. As I said just a minute ago, it's a collaboration between ME Foggy Dog and Stripy Lightbulb. Changed the date, but how many of you actually know why 29th of October should be a significant date for our community? But it's simply not. It's the date that the NICE guideline 2021 was finally published after the unprecedented pause. And most ME patients are in agreement that since the 29th of October 2021, we haven't felt any tangible change. We'll explain later that there's minimal adherence to the NICE guideline. So because the 29th of October isn't a significant date because of NICE, I'm now turning it into a significant date with Bedford Severe ME. And I'm going to use this date annually to push for social change for severe ME. Because with Stripy Lightbulb's training, I kind of concentrate on ME, CFS, generally, and I do a comprehensive overview and it's evidence-based and it's really good training, even if I do say so myself. And severe ME is included. However, you could literally fill a degree module with severe ME. And I feel like we need to do more to raise awareness of that degree of severity. So as you can see on the screen, BED consists of 6 different elements. There's wear your PJs to work, music for bed for severe ME, buy a badge. I'm wearing mine, Anna's wearing hers. They've been on sale since maybe June, and I think we've sold about 60 now. But if you want to buy yours to raise awareness of severe ME all year round, go to MeFoggyDog.org and buy yours. The profit gets split 50-50 between Smile for ME and Cure ME. So you're helping to fund ME research and donate to Smile for ME at the same time. On the 29th of October every year, we'll be asking people to donate, again, for Smile for ME and Cure ME. And we're asking people with ME, obviously those that are unable to leave their homes, leave their beds, or, you know, maybe they're going through a crash on that particular day, to have bed parties on social media. How you choose to do that is entirely up to you, but we want to be as inclusive as possible. And then finally, the In Loving Memory Board. On that board, I think it's around a handful of people have now left their own in memoriam posts for people who've passed away with ME CFS, and it's an international In Loving Memory Board. So yeah, so that is on there all year round, but they will all be big things on the 29th of October next year, because today is literally just to mark the change of the date and also to tell you about our fantastic secret project, but that's coming soon. Get excited, everybody. Next slide, please. Okay, so Bedford Severe ME links to our wider work for severe ME in recent years. In February 2024, ME Foggy Dog launched the NHS protocol campaign, and it was an open letter, and it was sent to every single health minister in all UK nations. So England, I was going to say France. No, I'm not talking about Six Nations rugby. Apologies. England, Wales, Scotland, and Northern Ireland. And it's a work in progress. All of the emails I had back from government were, we've got this, we're working on the delivery plan, thanks for your comments, but don't worry about it. Essentially, that was the reply that I got from all 4 nations. So I started to think, hang on, all of the central governments, even when they say, oh, we're going to implement X, Y, Z, there's maybe an 18-month time frame. And then they've got to go to local ICBs to see if they will adopt this initiative or protocol or whatever. So I just thought, I'm going to go straight to the ICBs. So in August, for the original Bedford Severe ME Day, I asked people with ME to contact their local health board, whether that's ICBs, integrated care boards in England, health boards in Wales, I think it's health trusts possibly in Scotland, and I can't remember what it is in Northern Ireland, but I did it for all 4 nations. And I said, please introduce me, share this open letter with them, and ask them to have a conversation with me on what they can do locally to help people with ME. And I know at least 15 people told me that they had done that, which I was blown away by because I wasn't sure whether anyone would listen to me. And I've now had 4 conversations with ICBs, and all 4 were positive. So what I would say is, it's not too late. The information for how to contact your local regional health board, wherever you live in the UK, is on mefoggydog.org. There's even a letter template, and I would ask you to copy and paste that and send that direct to your own local ICB, because I'm thinking it's a bit like when you contact your MP and they say, we only want to deal with people that live here, because otherwise we don't know if this is an issue that impacts our residents. So yeah, so if you could do that, I would be very grateful, whether you're tuned in today or watching this on YouTube. And my own MP, Stephen Morgan, because he helps me with my work with my VCSEs and represents me as a constituent, has now forwarded the open letter and the secret project to Wes Streeting direct. So I'm waiting for a reply, but apparently the chances of getting a reply are a lot higher if it comes from my MP. So I'll keep you updated. Next slide, please. Oh, hang on, no, I was going to go back. Sorry, my fault. I was going to read out the, so on the screen, oh, is the 4 demands that were contained in the NHS protocol campaign. So specialised care pathways, education and training, research and innovation, and patient involvement. Now I've been campaigning for those since February. And when I say clear and standardised care pathways, I mean commissioned services by ICBs and hospitals, where if someone with severe ME goes into hospital, there is a very clear, this is what we want you to do with that person. The research says you should try this, because at the moment, as you'll find out later, there are no commissioned services anywhere in the UK. Hang on, I'm getting there. Next slide, please. So these are some comments that were left on my open letter. And I thought, involve the community with this webinar. All comments were left anonymously. So first comment was, I have had severe ME since 1997. I have not met a single medical professional since 1997 that understands what ME is. My 31-year-old daughter has severe ME following COVID in 2020. She's had no specialist care except for what we pay for, and that is online. Her condition has steadily deteriorated. She cannot access traditional care via outpatients or in hospital, as she is bedbound and cannot travel. There is nothing for her. Individualised care, including domiciliary visits, is urgently required. And I've heard this next one many times. At times, I felt like I am physically dying, and I'd rather die at home than go to hospital, which will also likely make me die, as they do not have anything in place for severe ME. And finally, as a GP, there is an astonishing lack of support for severe ME patients. We are left unable to obtain secondary care opinions for those unable to leave their bed. Clear, implemented pathways would be so helpful. Next slide, please. Okay, right. This is what I've been really excited about. This is the culmination of 5 months worth of work. So, hang on. I am very pleased and excited to launch a new collaborative project today. This is a collaboration between my 2 social enterprises, the ME community, various stakeholders, and Sandfire Design. Ready? Drum roll, please. Next slide, please. Welcome to the ME-friendly hospital charter. This originated from a conversation I had after one of my many regular NHS collaborative meetings. This one happened to be in Cardiff. Hello to everybody in Cardiff who's tuned in. The person I spoke to knows I've said thank you personally to this person, but I won't name her here. Was incredibly supportive of the protocol campaign, but asked if I'd considered a charter. And I have to admit, I hadn't. I think I'm so used to us not having what other conditions have that it had never occurred to me. But I went away and I researched the dementia charters and the Parkinson's charters. And in many cases, the language and the needs overlapped. So the charter that I've created isn't a copy. I haven't copied and pasted and whatever, but I've kind of done the same framework. But a lot of stuff that's included in dementia and Parkinson's charters isn't appropriate for ME because it mentions things like treatments and cures and commissioned services, which we do not have. So I spent time recruiting people with ME. If you follow Foggy on ME Foggy Dog on social media, you will have seen me say, I'm doing a secret project. If you want to help, get in touch and I'll give you some more information. Very cloak and dagger, and I apologize. But that's what this was for. And I managed to recruit over 20 people from within our community of all severities. And we had a focus group. Everybody that couldn't attend the focus group because of their ME were able to answer exactly the same questions, but by email. They're also given a video recording of the focus group, so they felt included if they were able to listen and watch. And then they could kind of completely get involved in the process, even if they couldn't actually participate in the online meeting. It was a diverse group of people. So I'm very happy that every single part of the spectrum of ME was represented in this work, because we did follow-up surveys, questions, and you'll see we kind of worked out what our priorities were, and we had a really wide range of input. And I was really, really pleased, and thank you everybody that took the time and used their energy to help to create it. What I would say though, the ME community is very used to documents being created that you print out and you take to hospitals. This is not that. One, it's a waste of your ink because there's a lot of colour, but it's also to reduce the burden on you having to advocate for yourself. This document will be implemented by hospitals or ICBs, and they will then self-regulate and self-monitor. It's up to them to make sure their staff are adhering to it, not you. And in this document, we are asking for basics, including kindness, dignity, and respect. And I would say at the moment with ME in the UK, but it's an international issue, it's a perfect storm of a poor knowledge base on the disease, the false narrative that ME is psychosomatic, the fact we've got no commissioned services, the fact that we've got no treatments, all of it is a perfect storm. And I personally feel that this overrides arguments over what ME is and is not. Because I think we've all seen the newspaper articles of people that say that ME is psychosomatic, but in exactly the same breath, they say, but it's a terrible disease. Okay, so I know that ME is not psychosomatic. I know it's biological. However, to implement this charter, it overrides false beliefs of medics, because everybody is entitled to kindness, dignity, and respect. And this is what patients have said they want and they need to be able to access healthcare safely. So As it says on the screen, over the past 7 weeks, it has been shared with the Welsh Government, 4 Welsh health boards, the Secretary of State for Health and Social Care, Wes Streeting, 4 ICBs in England, and weirdly, I was in conversation with 3 universities and I was helping them improve their training. And I said, oh, I've just created a charter about, how to improve healthcare for people with ME and similar. This is for ME, but I'm in no doubt that it will also help dementia patients, people with autism and where it's sensory overload, etc., etc. But initially, it's solely for ME. So the 3 universities were talking to me about the charter, and they all said, actually, there's an element of our training where we tell it's the soft skills, so communication and the wider ways to communicate with patients to make sure that they get the best care. So it's now been shared with 3 universities that train nurses and midwives. And that's just a start. That's 7 weeks from someone that's got ME and can only work 20 hours a week. So now we've launched it. The plan is to get as many eyes on it as possible, because I just think, sky's the limit. So many people will benefit from this. Next slide, please. So this is a video. You will have a link to the whole document. You can read it in your own time later, but I've just done a quick flip through if Anna wants to press play. Most people are most impressed with the sound of the page turning. Okay, so as I said, you'll be able to look through that in your own time after. We're going to be sharing a reference list with everybody, and the link to the charter is in it. Next slide, please. So there are over 20 principles included in the charter. All were thought up by the people in the focus group. However, there are 5 top key principles, and these were chosen by members of the ME community, and these are non-negotiable. This is a living document. I'm well aware that some ICBs will want to implement some bits but not others, but I said, what top 5 things are we absolutely not going to budge on? So these are them. I don't know if you can read them. You should be able to. So patient and carer expertise. The individual with ME and their carers are most knowledgeable about their condition. Their insights and experiences should be prioritised in care planning and delivery. 2, first do no harm. Hospital staff must be vigilant in avoiding actions or treatments that could exacerbate ME symptoms. Even seemingly minor interventions can have significant negative effects. 3, mandatory reading of the 2021 NICE guidelines. All staff involved in the care of ME patients are required to familiarise themselves with the 2021 NICE guideline as a minimum standard of practice. 4, avoid encouraging overexertion. Patients with ME should never be encouraged or forced into overexertion. Staff must understand that even minor activities such as exposure to light, short conversations, or sitting up in bed can be overwhelming. 5, comprehensive ME-specific care plan. A detailed, individualised care plan must be developed for each ME patient as soon as possible and strictly followed to ensure their needs are met effectively. Okay, so that's the top 5 and what we're not prepared to budge on. Okay, next slide, please. Just so we're all on the same page, I want to show you what severe, very severe ME looks like. This is the level of severity that this webinar is talking about. So our CPD accredited training includes how ME presents, symptoms, PEM, but we're not going into that today. Anil van der Zee is a Dutch former ballet dancer. He creates very good awareness videos with very limited energy. He has got a YouTube channel, and there will be a link in the reference list. So this is a 5-minute video. And this should, if you don't know what severe, very severe ME looks like, this will open your eyes.
Some mistakenly believe that my illness is primarily about fatigue, but it's rather characterized by a severe exacerbation of symptoms which manifest after a minor physical, cognitive or emotional exertion, which is often referred to as post-exertional malaise. I always feel like I'm poisoned and oxygen deprived, especially during one of these post-exertional malaise crashes. I'm in bed all day because of my orthostatic intolerance. If I was primarily fatigued, I probably would be walking outside on the street right now. Fortunately, since I moved to a new place, my condition has stabilized somewhat and I've gotten an electric wheelchair that has given me more mobility and space to breathe. I'm now able to get to the toilet myself and dispose of my own urine in the toilet instead of the kitchen sink for the past 5 years. I have also been forced to defecate in a trash bag because I can't sit up for long enough. For a few weeks I've been using my amazing friend's designed bathroom, specifically for someone with orthostatic intolerance, complete with a plateau and a toilet where I can lay down to do my business. While still not ideal, this is a significant improvement from using a trash bag. And I'm grateful that I'm no longer so severely affected that it's too much effort. After years of darkness, I can now occasionally do a bit extra on a good day, such as take in fresh air from the outside world. Or spend a few minutes enjoying the world with Grigor on the other side of the house. Or even bask in some sunlight. There's still a screen that blocks quite a bit of light. But even so, this would have all been unthinkable 2 years ago. Unfortunately, These activities often come at a cost, in the form of a crash that can last for days, weeks, months, or even cause a relapse. It's always challenging to determine how long a crash will last. Therefore, I can only do these things sparingly. It's frustrating that even enjoyable activities can make you feel incredibly more ill.
Okay, and now you can see why I chose to screen that video. It's powerful stuff. And be in no doubt, there are millions of people like that around the world now. And my personal view is that there are at least 1.25 million people now with M or who have ME-like symptoms. And if a quarter of those have severe, very severe ME, that's a lot of people that present in the same way as Anil. And that's why we need to step everything up in terms of getting adequate healthcare. And I can't do anything about the treatments. I'm not a scientist, but I can improve wider healthcare and how you're treated in a healthcare environment. So, what is the status quo in 2024? Anna will take you through what the current guidance is, and we'll show you the work that Stripy Lightbulb and M.E Foggy Dog have done to try and fill the gaps. Over to you, Anna.
Thank you. Can you hear me okay, Sally? Excellent. So thank you all. I'm going to talk you through the NICE guidelines. The NICE guideline is the only officially recognised medical guidance for ME CFS in existence in the UK. Within the NICE guidelines, there is a section 1.17, care for people with severe or very severe ME CFS. And this outlines key information on how to support patients. And I'm going to talk through some of that guidance now. We strongly recommend that medical staff of hospitals and care providers read and implement the NICE guidance as a bare minimum. In May 2023, Action for ME research found only 28% of NHS trusts and ICBs were implementing the NICE ME CFS guidance. People with severe or very severe ME CFS may experience many symptoms will significantly impact their lives, as we've just seen, including their mobility. The NICE guidelines list these symptoms, and I've highlighted some of the key ones here. The ability for them to care for themselves, severe and constant pain, hypersensitivity to many sensors and temperature, reduced movement and extreme weakness, reduced ability to swallow and gastrointestinal difficulties. And it's these two symptoms which are key contributors to the loss of life in very severe ME CFS cases. It is important to recognise that these symptoms of severe and very severe ME CFS may mean that sufferers need a low stimulus environment, for example, a dark, quiet room with interaction at a level of their choice. They may be housebound or bedbound and may need support with all activities of daily living, including aids and adaptations to assist mobility, such as a wheelchair. They need careful physical contact when supported with activities of daily living. And they need to choose someone to be their advocate and communicate for them when that becomes something that they can no longer do for themselves. They may be unable to eat and digest food easily, and may need support with hydration and nutrition. And they may have problems accessing information, for example, because of difficulty with screens or sound and light sensitivity. Headaches will affect their ability to read, or they may experience brain fog affecting their concentration. So even when sharing information with them, these things need to be considered and to be mindful. The NICE guidelines recognise that ME CFS person may have difficulty accessing services and articulating their needs. Therefore, an appropriate care plan may include home visits, online or phone consultations, supplying written communication, and supporting their application for aids and appliances. The NICE guidelines also recommend that when supporting someone with severe or very severe ME CFS, that the care person is known to the patient and the family if possible, that the care provider is aware of the person's needs, understands all the symptoms listed and the impact that that can have on the patient's health and well-being, that the care person assesses the risks appropriately, agreeing to a care plan that meets the patient's needs and will benefit the patient and not worsen their symptoms. Finally, that the care person discusses the care plan with the patient and their family with a focus and engagement on the person with ME CFS. Severe or very severe ME CFS patients will end up in hospital. And when planning hospital care for people with severe or very severe ME CFS, the NICE guidelines recommend that the medical teams discuss with the person and their family or carers what to expect when they come into hospital. Aim to minimize discomfort and post-exertional malaise during transfer to hospital, for example, by planning the route in advance, avoiding noisy areas, and admitting them straight onto a ward when arriving. Discuss the person's care and support plan with them, including information on comorbidities, intolerances, and sensitivities, and to plan any reasonable adjustments that may be needed. If possible, aim to provide a single room and keep stimuli to a minimum. For example, seeing them one-on-one, using calm movements and gestures, not duplicating assessments, being cautious of the pressure of touch, keeping lights dimmed, reducing sound, and keeping a stable temperature and minimizing smells, because all these sensory can be overstimulus for someone with severe ME or CFS. Severe or very severe ME CFS sufferers must be monitored when in hospital care, as they're at high risk of malnutrition or unintentional weight loss. And this is because of restrictive diets, poor appetite due to altered taste, food intolerances, nausea, and difficulty swallowing and chewing. The advice given by NICE is to encourage eating little and often, provide nourishing snacks and drinks, and finding easier ways of eating to conserve energy, and using modified eating aids when required, or when required, providing oral nutritional support. Currently, MPs in your local constituencies are more informed than NHS staff about how best to advocate and support people with severe or very severe ME CFS. And this is thanks to a politician's guide created by the Chronic Collaboration, Stripy Lightbulb, and ME Foggy Dog. This guide is listed in your resources list and was created because all other avenues had been exhausted and because of the COVID-19 pandemic. There are likely now 250,000 severe or very severe patients in the UK, and of those, at least 7,500 in Wales. Based on these numbers, it is very likely more patients with ME or CFS will end up in hospital requiring care to save their lives. As I mentioned, this document is available on your resources list and it is worth reading. It highlights the NICE guidance that I've covered in this document. But again, if you're NHS staff, I strongly recommend that you do have a read of the NICE guidance. And over to Sally, who's going to explain some of those more recent cases that have ended in hospital.
Thanks, Anna. Next slide, please. That still tickles me. I was like 2020 flashbacks. Right. You may have seen media coverage of Maeve Boothby O'Neill's inquest in recent months. Maeve died on the 3rd of October 2021, aged 27, just before the latest NICE guideline was published. In a recent newspaper article, her father, Sean O'Neill, said, "The inquest heard that none of the medical staff treating her had any training or received any education in treating severe ME. Several professionals did not believe her illness was real. At the end of her life, palliative care was delayed because of that disbelief. The coroner was told that there were no specialist units, no wards, not even a bed anywhere in the NHS treating severe ME. There were no policies, protocols, or guidelines for the treatment of ME in 2021, and there are still none today." So I think the key message from that is absolutely nothing has changed since the NICE guideline was published. So this screenshot was taken from the Courts and Tribunals Judiciary website, and these were the coroner's concerns. She's listed them as: during the course of the evidence, it became clear that there were no specialist hospitals or hospices, beds, wards, or other healthcare provision in England for patients with severe myalgic encephalomyelitis, ME. This meant that the Royal Devon and Exeter Hospital had no commissioned service to treat Maeve and patients like her. During the course of the inquest, it became clear that there was no current available funding for the research and development of treatment and further learning for understanding the causes of ME, CFS. And during the course of the inquest, it became clear that there was extremely limited training for doctors on ME, CFS, and how to treat it, especially in relation to severe ME. During the course of the inquest, it became clear that the 2021 NICE guidelines on ME did not provide any detailed guidance at all on how severe ME should be managed at home or in the community, and in particular, whether or not there is any necessary adaptation needed to the 2017 guidance on nutrition support for adults, oral nutrition support, enteral tube feeding, and parental nutrition. Much of this, if you remember, has been included in our NHS protocol campaign since February. And yet we've repeatedly been told, one, it's not an issue, and two, we're working on it. Well, when is it going to change? Governments have said their existing strategy is working and will improve services. Well, we can only keep trying and pushing in the right direction. As you can see on the screen, the coroner sent that to Wes Streeting and Andrew Gwynn, NHS England, NICE, Medical Research Council, and Medical Schools Council. Next slide, please. That's not me, is it? Is that Anna? Is that you drawing on the thingy?
No, it's all right. I've just put a message in the chat of where it's coming up.
Oh,
it's not
okay.
me.
It's not me. I'm not touching it.
No, it's not you. Don't worry.
Okay, so this is happening in 2024. I don't want to inaccurately represent these two cases, so there is more information in the reference list. But just to say that Carla was recently inappropriately sectioned after being in hospital for over 9 months. That's being fought. I don't think we've had an update on that yet. And Karen Gordon continues to fight, and she's deteriorated since being in hospital. Both of these cases are in there due to gastric issues. And there's an extract from a Canary article at the bottom where it says, the Canary asked West Middlesex Hospital for comment. It took them 4 days to formulate a reply, and the spokesperson said, while we cannot disclose any patient disclosure, disclosure any patient information or individual care plan, we are committed to providing the best care and support for all patients. Our staff are committed to following NICE and NHS guidelines throughout the care we provide. And as the Canary have put underneath, it's clear that in Carla's case, staff are not following the NICE guideline. In fact, they appear to be actively working to flout them. The articles that I've put in the reference list include examples of medics walking into the room talking at full volume, even though the family have told them repeatedly since day one back in January that she's very sensitive to noise. They've put barriers up at windows and covered them with paper to block out the light, and the staff have come in and ripped that down, and she's deteriorated as a result of that. That just those two factors are included in the NICE guideline. And there are no NHS guidelines for severe ME, so I'm not entirely sure what that statement means. Yes, I will do, Francesca. I plan to send the reference list, and I'll post it on YouTube. But yeah, the updates on these two cases will be in the reference list. Next slide, please. Okay, so people with ME will know this. Steve Topple is a Canary editor, but he's also the partner of someone with ME and a wide range of other chronic illnesses, and he has lived experience of advocating for very severe patients. He's helping Carla's family right now right now to bring about better care for Carla. So I asked him to contribute to this webinar as someone with lived experience of being an advocate for very severe ME, because obviously the family members are already doing the caring duties every day. Steve concentrates on, he cares for his partner, but he's also focuses on advocacy. The full document that he wrote for me is in the reference list and it's well worth reading, but this is the extract that I'm going to read now. Crucially though, in all of this, listen to the patient and their family. The biggest roadblock for severe, very severe ME patients in a secondary setting is HCPs making assumptions and failing to listen to the patient, their families and their advocates. Despite what you may have learned, been told or read in the literature, ME is not psychological and their mental health and or emotional well-being is not causing or worsening their symptoms. For example, severe, very severe ME patients may present as intermittently or fully non-verbal. This is not a matter for speech and language, nor is it the patient being obstructive. The hallmark symptom of ME, post-exertional malaise, means that for a severe, very severe ME patient, the exertion of speaking can result in a worsening of all symptoms and potential deterioration in overall health. Therefore, they often avoid speaking wherever possible. So, I mean, that's just a, everyone in the chat, it keeps coming up and distracting me. Sorry, I'm very easily distracted. Yeah, I would say that that's a communication issue. You know, so the staff in this particular case haven't listened to the family and they're trying to communicate with the patient despite being told actually they're non-verbal at the moment. You need to speak to us. So yeah, it's but this ties into the, if they think it's psychosomatic, they will not be thinking about physical reasons for that person not being able to speak. Next slide, please. Right, this is also happening right now, literally this week. Fiona is one of my many ME friends I haven't met yet. Fiona is a former nurse. She knows a bit of stuff about biology, and she also does a bit of advocacy. She's also got severe ME. So these tweets are from the past week or two. So she starts off saying, wish me luck, I'm off to Royal Bournemouth Hospital, hopefully to get TPN, which is I think is a feeding tube. And then she says, in AMU Bournemouth, junior doctor knows about mast cell activation syndrome, but not ME. Bless her, because she's so nice. Nurses don't know ME either. So far, so good, but the noise, and then unhappy emoji. They're referring me to gastro. And then in the next tweet, she says, I'm longing for my quiet bedroom at home, whilst I seem to be coping with the noise and light via earplugs, ear defenders and blackout eye mask. The noise, which is sadly grating, is another patient screaming out. As for severe ME patients being in a side room, the majority of staff haven't heard of ME, it seems, let alone the NICE guidelines. Next one, nobody has been around yet. No food since yesterday lunchtime. Can't drink these Fresubin drinks. They're nutritional drinks. I've seen them. Apparently they don't taste very nice. They're too rich. I honestly wonder if it's worth the fight. As she just said to me, it's too hard to get care. I may as well go home and let nature take its course. I'm not depressed in saying that. I'm just being realistic. Thanks to Jenny for everything and Dr. Weir. Jenny is Dr. Weir's admin. So Dr. Weir is one of the very few private specialists on ME in the UK. So the best person for him to talk to would be the dietetic consultant if he turns up. It's really interesting that I'm suffering severe pain and bloating on eating, anything the same as Carla, but most definitely not as severe. I'm still managing drinks and I'm reacting to the supplements too. I also have seizures, not epileptic, especially when my senses are overwhelmed or someone walks to me suddenly and starts speaking loudly. So she was talking about being discharged from hospital, and she says, so I didn't make it home because my brain and nervous system decided to react to all the overstimulation and revolt by me having non-epileptic seizures. She's had six-star treatment, but still no further forward regarding eating. had some ice cream and fruit, and stomach went bloated plus severe pain. It's instant. So you can see she's been in there a while. Like, I think this was over a week. I think she went in on the 17th, and that update was on the 22nd. And it's the overload. She's not in there for her ME. She's in there for gastric problems. But the overexertion is causing other symptoms. And the overexertion is caused by the sensory overload, so noise, light, and obviously her body's physically reacting to the food, so that's also exertion. Next slide, please. So this is the late, I think she did one yesterday, but this was the day before. She said, longest time I've ever spent in hospital. Put on a low histamine and low FODMAP diet on Thursday, plus gluten-free as normal for celiacs. Still better than the supplements, however, now breaking out in hives and very itchy, as well as the pain and bloating. So this is mast cell activation syndrome. Couldn't breathe Thursday night. I was choking and thought my airway may be narrowing. Finally got an O2 mask next to the flow meter. Now told nurse I'll pull the red emergency bell and apply my own O2 mask. Ironically, the tablets that could help, which I've purchased, aren't prescribed in Dorset, apparently, even though I've bought them. Reconvene Monday with doctors and hopefully nutritional support team. I know it's mast cell activation syndrome doing this because it doesn't matter what I eat, but I have to give them evidence while I'm in agony. She's also been diagnosed with functional gastric pain syndrome. One of the things we've got in the charter is do not question someone's diagnosis that they've probably fought really hard to get. And I don't know. I haven't spoken to her, but I'm wondering whether they're saying, no, it's not mast cell activation syndrome, it's functional gastric pain syndrome instead. So as I said, Fiona is a former nurse. Medical staff often know very little about mast cell activation syndrome, postural orthostatic tachycardia syndrome, or Ehlers-Danlos syndrome, or they may not know that they are common, to the point where they are so common in ME, they could almost be described as part of the disease itself. And they may not know that that's what the person is presenting with. Mast cell activation syndrome, POTS, and Ehlers-Danlos syndrome are very common comorbidities in people living with ME, particularly in severe, very severe ME patients. I personally have EDS and mast cell activation syndrome, but I do not have a confirmed diagnosis because we don't test for that on the NHS. I would say gastroparesis is also an issue for ME, particularly severe, very severe ME. And again, medics may not realise that that's common in ME, so they're not necessarily joining the dots. They're treating it as a separate issue. And on my card, I've put, there is very clearly in that tweet on the screen now, there's very clearly an overlap of comorbidities. HCPs shouldn't solely concentrate on one condition. You can see the impact of hospital admission is having on the ME. So when Fiona does eventually get discharged, her ME will be a lot worse for days, weeks, months. ME should be managed alongside the reason for the hospital admittance. And that's what we mean about care pathways. You should always consider the ME when you're treating the reason that they are in hospital. That doesn't happen at the moment. Next slide, please. So in summary, the NICE guideline was an improvement on what went before, but has significant gaps and omissions. The NICE guideline is the only official medical guidance in the UK for ME. Only 28% of ICBs and NHS trusts in England had implemented the NICE guideline in May 2023. During Maeve Boothby O'Neill's inquest, it was stated that there is not a single bed in the NHS for people living with severe or very severe ME. There are no protocols or policies in place to treat people living with severe ME. There is an urgent need for appropriate services to be commissioned locally, regionally, and nationally. And healthcare staff are professionally vulnerable, and patients are at greater risk in the absence of official protocols and policies. Because if you don't have commissioned services, healthcare staff can't be dealing with the patient in front of them and think, I know what's going to make this better. and they can't implement that treatment, whatever that may be, if it's not part of a commissioned service or if it's not part of a protocol, because then they're literally working off label and they could be referred to the GMC. That's why it makes them professionally vulnerable. So in many cases, healthcare professionals may really want to help. They may know what they need to do to help, but can't do it because the rules and regulations simply don't allow them to. And that's why the protocol is asking for clear care pathways, and that would include commissioned services. Next slide, please. So to go back to the beginning, call to action, help to implement the ME-friendly hospital charter. Healthcare professionals that are tuned into this, it's time to take a stand for better healthcare and support for people with ME. The ME-friendly hospital charter is a vital step towards improving care for patients with ME of all severities. Now we need your help to make it a reality. Join us in advocating for the adoption of this charter in your integrated care board, health board, NHS trust or hospital. Together we can ensure that people with ME receive the compassionate, appropriate and dignified care they deserve. Let's start the work now to transform healthcare for ME patients. Your voice and action can make a difference. As I said already, the link is in the reference list. My brain's starting to go in the reference list that Anna is going to add to the chat. But yeah, so any help you can give us with that would be very gratefully received, because it's got to come from execs in ICBs, health boards and hospitals. We need change, and if that means starting with the charter where we start with kindness, dignity and respect, then that's what we have to do. Next slide, please. Okay, so thank you everybody for attending today's webinar.